Attention Deficit Hyperactivity Disorder, or Attention Deficit Disorder, is a neurodevelopmental disorder that affects children and adults. It's best explained by a long-term pattern of either or both of inattention and hyperactivity impulsivity, and this must be extreme and interfere with the person's ability to perform their day-to-day tasks. In this video, we'll be talking about what ADHD is, the official updated definition of ADHD, and the three main types of ADHD. Welcome back to the channel. I'm Wahid. I'm a final year PhD student at the University of Oxford and a medical doctor in the UK's National Health Service. Here I share the lifestyle that I've built that helps me excel with ADHD and find the best techniques and gadgets to help you with your ADHD. I pay the ADHD tax so you don't have to. ADHD affects around 4% of children in the UK, where it's most commonly diagnosed at ages 3 to 7. ADHD is being diagnosed at older ages as we understand more about it. ADHD is more common in boys than girls by over threefold, but diagnosing the disorder in girls can be very challenging as they don't tend to follow the typical presentation that boys do. It's been quite well known now that ADHD tends to decline into adulthood, and only about 15% of individuals who had ADHD as a child have ADHD at age 25. Or often they have it, but it's just not as severe anymore as the brain develops. The likelihood is if you have significant ADHD in adulthood, you'll have some form of ADHD for the rest of your life. ADHD is a complex disorder. It's caused by both genetic and environmental factors, but it's predominantly a genetic disorder. In twin studies, it's been found that ADHD has a heritability of around 80%, and this means that if you have a family member who has ADHD, either a brother, sister, or a parent with ADHD, it's far more likely that you'll have ADHD. The remaining causes of ADHD can be down to the environment you were exposed to during development, and this includes being of a low birth weight, maternal smoking, alcohol or substance exposure, epilepsy, brain injury and anemia. ADHD can share some symptoms with lots of other conditions such as thyroid disease, autistic spectrum disorder, personality disorders and even anxiety and depression. Having ADHD means you're significantly more likely to have mental health disorders or learning difficulties. You're more likely to be involved in road traffic collisions and more likely to have traumatic injuries and accidents, and that's why diagnosis of ADHD is associated with a shorter life expectancy. A large Danish study in The Lancet in 2015 followed up 2 million people, including 32,000 young adults with ADHD. It found that people with ADHD are more than twice as likely to die prematurely compared to those without ADHD, even after adjusting for other factors. So it's very important to diagnose ADHD earlier so people can be counseled around their diagnosis and offered treatment. So what are the diagnostic criteria for ADHD? There's two international standards for diagnosing ADD or ADHD, and that's the DSM-5 classification by the American Psychiatric Association and the ICD-11 classification by the World Health Organization. For a diagnosis of ADHD, the pattern of inattention or hyperactivity symptoms must meet either of these two diagnostic criteria. ADHD must also clearly interfere with an individual's education or work life and be pervasive, meaning it impacts across more than one setting. Importantly, ADHD must have been there since childhood. Generally, for a diagnosis of ADHD to be made, the symptoms can't occur exclusively during a schizophrenic episode or another psychotic disorder, or be better explained by another mental health condition, for example, anxiety or depression. It's for this reason that a diagnosis of ADHD can only really be made by a psychiatrist, pediatrician or a medical professional with a specialism in ADHD and be based on a detailed history, observation and evaluation of the patient. Let's go through the DSM-5 criteria first. So in order to be diagnosed with ADHD, you must meet at least 6 of the 9 symptoms of inattention or at least 6 of the 9 symptoms of hyperactivity impulsivity if you are less than 17 years of age, or 5 of the symptoms if you are an adult age 17 or older. And these symptoms must have been present for over 6 months and impact your study or work-related activities. I want you to really pay attention and reflect over these symptoms to see what essential criteria you might meet. It's often the case where you might not know what particular symptoms you have, but are told by others that you meet these symptoms. So for example, I meet all 9 of the inattention symptoms and all of the hyperactivity, impulsivity symptoms. And symptoms like poor organisation, I've worked on heavily, but when I was younger, this was something all my teachers would talk about. But I didn't necessarily think I exhibited this. And also in terms of hyperactivity, impulsivity, it's hard to realise that you're driven by a motor. Your hyperactivity may feel normal to you until people start commenting on it. So in school, I'd be in such a rush to answer questions correctly that I'd blurt them out. And I even had feedback from my teachers during parents' evening where they mentioned I was driven by a motor in the exact way it's listed here. This really led to me being diagnosed with ADHD as an adult during med school. The DSM-5 criteria I think has quite arbitrary age cutoffs, and a lot of the symptoms are ambiguous, so clinical interpretation by a health professional is required. The problem is that a lot of these symptoms don't lend well to adult ADHD. In the parentheses, there's often words like can't play quietly or driven by a motor, which don't translate well to adulthood, generally speaking. The ICD-11 criteria is a more current and updated diagnostic criteria for ADHD, and I reckon it's not perfect, but it lends better to a diagnosis of ADHD in adulthood by using phrases like work assignments, comments at work, and using adolescents and adults in parentheses. Different types of ADHD. These classical symptoms of inattention or hyperactivity impulsivity cluster differently in different people with ADHD. There's sort of a spectrum, and based on the DSM-5 criteria, there's 3 different types of ADHD: predominantly inattentive ADHD, predominantly hyperactive ADHD, and combined ADHD. This is a graphic by the Mini ADHD Coach on Instagram, which summarizes this well. In type 1 ADHD or predominantly inattentive ADHD, a person with ADHD meets at least 5 or 6 symptoms of inattention in the past 6 months, but not those of hyperactivity impulsivity. In type 2 ADHD or predominantly hyperactive impulsive ADHD, there's enough symptoms of hyperactivity impulsivity, but not of inattention in the past 6 months. And in type 3 or combined ADHD, a person with ADHD meets the criteria for both hyperactivity impulsivity and inattention over a protracted period of time. This is the most common form of ADHD, affecting over half of all people with ADHD, and this is the subtype that I have. What's interesting is that you can cluster in different groups or even no longer have clinical ADHD as time progresses, and that's because your symptoms might improve or change. And as I mentioned earlier, around 15% of children with ADHD no longer have clinical ADHD by the age of 25. However, if you have ADHD into adulthood like I do, it's likely you'll suffer from this for the rest of your life. Okay, in this video we talked about what ADHD is and what the 3 main types of ADHD are. For more videos on how I stay on top of my ADHD whilst being a doctor in the UK and a PhD student at Oxford University, please subscribe for more and let me know in the comments what topics you want me to talk about next. Till next time.